Hello friends, welcome back to another video. Today video topic is about RBC WBCs, platelets and blood clotting disorders. Let's start the video. The red blood cells disorders, also known as erythrocyte disorders, are conditions that affect the structure, function or production of red blood cells. Some are common examples of red RBC disorders includes anemia. The anemia is the condition characterized by the lower than normal number of red blood cells or lower amount of hemoglobin in the blood. It can be caused by various factors including nutritional deficiencies, chronic disease and genetic factors. Symptoms of anemia: fatigue, weakness, pale skin, shortness of breath, dizziness, cold hands and feet. The treatment for anemia is the treatment depends on the underlying cause, but it may include iron supplements, dietary changes, addressing any underlying health conditions, and in severe cases, blood transfusion. The next one is the sickle cell disease, a genetic disorder that causes red blood cells to become misshapen and break down more easily. This can lead pain, organ damage, and increase the risk of infections. The symptoms for this sickle cell disease is painful, painful episodes called crisis, fatigue, jaundice, frequent infections, delayed growth, vision problems. The treatment for sickle cell disease is pain management during crisis, medication to prevent complications, blood transfusion, bone marrow transplant in severe cases. Thalassemia. The thalassemia is a group of genetic disorder that result into decreased production of hemoglobin and red blood cells. There are various types of severities in thalassemia. The symptoms of thalassemia is fatigue, weakness, pale skin, slow growth, jaundice, bone deformities in severe cases. The treatment for the thalassemia is blood transfusion, iron chelation therapy to manage iron overload, bone marrow transplant in some cases. Next one is polycythemia, a condition in which body produces too many red blood cells. This can lead to thicker the blood and increase the risk of clotting. Symptoms are fatigue, headache, dizziness, enlarged spleen, itching, redness of the skin. The treatment for polycythemia: phlebotomy, it is known as removal of blood, medications to reduce red blood cell production, addressing underlying causes. Let's talk about the white blood cell disorders. White blood cell disorders involve abnormalities in the production, function, or level of white blood cells which play a crucial role in the body immune response. Here are few common WC disorders. First one is leukemia. Leukemia is a type of cancer that affects the bone marrow and blood. It leads to overproduction of abnormal white blood cells, crowding out healthy cells. The symptoms of leukemia is fatigue, weakness, frequent infections, fever, easy brushing and bleeding, swollen lymph nodes. The treatment for the leukemia is chemotherapy, radiation therapy, bone marrow or stem cell transplantation, targeted therapy. The next one is leukopenia. The leukopenia is a disorder which causes affect the blood. The symptoms of the leukopenia is frequent infection, fever, fatigue, weakness. Treatment for the leukopenia is treating underlying cause, discounting medication that suppress WBC production, managing infections. Next one is the lymphoma. Lymphoma is a cancer that originates in lymphatic system which includes lymph nodes, spleen and bone marrow. The symptoms for lymphoma: enlarged lymph nodes, fever, weight loss, night sweats, itching. The treatment for lymphoma is chemotherapy, radiation therapy, immunotherapy, targeted therapy, stem cell transplantation. Next one is platelet disorders. Platelet disorders are conditions that affect the number of function or production of platelets, which are blood cells responsible for clotting and stopping bleeding. Here are some common platelet disorders. First one is the thrombocytopenia. Thrombocytopenia is the condition characterized by low platelet count, which can lead to increase the risk of bleeding. The symptoms from some thrombocytopenia is easy bruising, patency, small red or purple spots on the skin, prolonged bleeding from cuts or injuries. The treatment for thrombocytopenia is treating the underlying cause, platelet transfusion, medication that stimulate platelet production. Next one is the idiopathic thrombocytopenic purpura, ITP. ITP is the autoimmune disorder where the immune system mistakenly attacks and destroys platelets. The symptoms for ITP is easy brushing, patency, nosebleeds, bleeding gums. The treatment for ITP is corticosteroids, immunoglobulins, medication that affect the immune system, splenectomy in some cases. Next one is a thrombocytosis. The thrombocytosis is a condition where the body produces too many platelets, which can increase the risk of clotting. The symptoms for thrombocytosis is often asymptomatic, but in some cases there may be clot, stroke or heart attack. The treatment for thrombocytosis is treating the underlying cause, medications to reduce platelets production or functions. Next one is the gray platelet syndrome. This is the rare genetic disorder cause platelets to have gray symptoms, gray appearance and function improperly. The symptoms of gray platelet syndrome is easy bruising, nosebleeds, bleeding after surgeries. The treatment for gray platelet syndrome is managing bleeding episodes, platelet transfusion, supportive care. The next one are blood clotting disorders. The blood clotting disorders are as follows. The first one is blood clotting disorder are hemophilia. The hemophilia, it is prolonged bleeding after injuries and easy bruising, joint pain and swelling in severe cases, spontaneous bleeding. The treatment from hemophilia is typically managed through regular infusion of clotting factor, considered managed through regular clotting factor. In some cases, medications can be used to stimulate body natural clotting process. Next one is thrombophilia. The thrombophilia, which increases risk of abnormal blood clot formation, which can lead to deep vein thrombosis, pulmonary embolism, other clot related issues. The treatment for the thrombophilia is the treatment varies depending on the specific type of thrombophilia. It may be involve anticoagulant medications such as warfarin or newer direct oral anticoagulants to prevent the blood clotting. Next one is a factor V Leiden mutation. The factor V Leiden mutation, it is increase the risk of blood clots, often leading to deep vein thrombosis, pulmonary embolism. The treatment for factor V Leiden mutation is management of usually involve anticoagulant medication to prevent clot formation, especially during high risk situation. That's about this video. Thank you.